Hey guys, today I thought I would talk to you about healthcare in Panama. As you guys know, I'm a nurse practitioner, recently retired last year, and I've been here almost 5 months. And I know this is a question that comes up a lot when people are considering moving to Panama. What is healthcare like in Panama? Let's just talk about generally, okay? Healthcare in Panama actually is pretty good. It's considered, I think it's like number 90 of the best 100 healthcare system in the world. The Panama healthcare system ranks higher than the US healthcare system. In terms of expenditure, as you know or may not know, the US pays the most money per capita, per resident, like $12,000 a year on each resident, which we know with the inequity, not a lot of our people don't have access, so they're spreading the numbers, but we're not really included. The average per capita expenditure for any country is about 6,000. The U.S. pays 12,000. Yet the healthcare system is ranked lower. I think Panama ranks like number 80, and America is like number 46. So we're not doing well. We're not comparing apples to apples, right? Panama, on the other hand, in 2020 spent about $1,200 per person. They have there are two sets of systems that manage health. It took me a little while because you would see Caja de Ahorros, Caja de Seguro Social, CSS, de Ahorros, that's the bank, and they, like the social security, they manage the money that people have paid into from their wages, right? And they also manage all the local state-owned hospitals, right? The public hospitals. Then you have the Ministerio de Salud, and there is an acronym for it, I can't remember right now. They operate those regional hospitals and those public health clinics, okay? So when you are a Panamanian and you have worked and you've paid into the social security system, your health care is free. If I come as a foreigner and something happens to me, I can still have access to those public hospitals, but the cost is going to be minimal. We're going to pay something. But what happens in those hospitals, there's usually a wait. If you go to regional hospitals, it might be a little bit better, but those hospitals, usually the buildings are a little older. The amenities are not the best, but people who've been in them said, they didn't have the bells and whistles, but it was clean. Nobody's going to speak English there, so you need to speak Spanish to communicate with your healthcare team. The physicians might, because a lot of them have been trained in the U.S. And they also have private hospitals, which is where expats have access, but then you have to pay out of pocket. Okay, so those public hospitals, everything is free for those citizens. You might have to pay a little bit, but if you go to those private hospitals, you're going to pay out of pocket. Okay. Now, most expats would pay out of pocket for like preventative care, have a history of physical, having some diagnostic work. Oh no, Siri is activated here. It's going to say, what do you want? And so this is where the expats go, to the public hospital. Public hospitals, they have like pretty much standards like in the US. A lot of the physicians speak English, they've been trained, and they have one, I think, that is associated with either Howard Hospital or Duke, don't quote me, but you get excellent care there. But you got to pay out of pocket, and then if you have a plan, like an international plan, the hospital will help you submit your claim so you can get reimbursed. Okay? They have other little nuances. There's a little hospital, Santa Fe, I believe. They have a plan that you can sign on, but you have to go there if something happens to you. Anyway, there are resources online if you want to learn about the Panamanian healthcare system. I just saw a great article. Okay, that is, yeah, they're having that regional, um, what's the word I'm looking for? You know, they're trying to see how prepared Panama is for emergencies and disaster drill. So the ambulances have been real busy today, and it's going to be tomorrow and Wednesday as well. Today's Tuesday, Wednesday and Thursday. So if you have an international plan, I already told you that, but there is an article that you could check out called the International Citizens Insurance, the Panama Healthcare System. If you Google it, it gives you like a nice overview of the Panama healthcare system. With medications, you know, I understand that very simple medication for diabetes, hypertension, you can walk into any pharmacy. Like I hear the same can happen in Mexico. And if you have your bottle, you can get a refill. You don't need a prescription. But if you're taking anything that is specialized, like if you have MS and you have some cancer drugs, make sure you check to see if they're going to be available here in Panama, because they may not be. And there is Expat Health, I believe, which is an organization, don't quote me again, but they cater to expats, and you can have a consultation with the physician even before you come to Panama, just to find out if your medication is going to be available. You don't want to get here and then all of a sudden it's like, oh my God. Due diligence, okay? So we talked about if you have Medicare, people have asked me, how is health care for Medicare recipient? I'm going to be, you know, I have my Medicare card already. That's going to be effective in July next month. My gosh, I'm going to be 65. And they don't take regular Medicare here. But you have to sign up with a Medicare Advantage plan, like the one offered by United Healthcare. I don't know if Care Plus or the others are here, but again, you pay out of pocket and then you submit your claim to get reimbursed. That's the way it works here, okay? I investigated in terms of 911, emergency plan. Yes, there is 911. And where I live, a lot of my little friend, the little pigeon, he hasn't left. That's my angel. He's sitting there. It's been over an hour. He's been sitting here. He hasn't moved. He's watching me. I'm watching it. 911 is available. The ambulances, I hear them going, but with the traffic that we have, if you are in an ambulance and you're trying to get to a hospital, there might be a delay, okay? So, I don't know. I haven't used it. I would take it with a grain of salt. If you can get into a car, if it's not like a compression where you need CPR kind of thing, you might get there quicker. I have heard in certain areas, like in the interior, like Boquete, they're like, you know, if you have an emergency, let somebody put you in the car. You can get to the hospital quicker than if you're waiting for an ambulance, especially at night. So when you move to a community, you need to make sure. That was the first question I asked, and I got the number of the police, 911, and I put them on my front door. Give it to my friend who has access to my information if something happens to me, and same for her. And so understand those parts, because I've heard some horror stories in some communities and countries where people get sick and they don't have access. This lady had a child had cut himself and she didn't realize there is no urgent care for you to go to. It can get a little bit scary. That's why if you're not someone like me, I'm not expecting to live forever. I don't have the need to be next to a big hospital so that I can rush there. If something happens to me, I tell my daughter, if I'm somewhere in the boonies somewhere, just leave me be. I'm not interested in getting the best of care. And some of these international plans will also med vac you back to the U.S. if something happens to you. So you have a trauma and they're not equipped to handle that here. They'll fly you over there. Okay, now let's talk about how is healthcare in Panama. Now, Most of us who've been here, we say, oh, the food is so good, it's so clean, it's got no pesticide, I feel better, I have lost weight. Well, I have heard that in the area of the country where most of the food is produced, they do use pesticides, okay? Just like when I got robbed, I was like, oh, I'm safe, I'm just loose, hanging out, and they stole my wallet. Same thing with with your health and nutrition. Don't have stars in your eyes thinking that everything you're buying is pure from the earth. So what do I see for Panamanians and those of us who are here, especially African Americans? We are here because we feel less stressed. We have left the rat race. We don't have to worry about police brutality, and there is not overt racism. And those of us who are retired, we don't have to worry about the microaggressions, right? So the stress level being low, you have less cortisol being pumped into your body, that sense of constant alertness and you're on edge, or you're on the road and you see a cop behind you and you think, oh my, might be my last day. I know, I always felt like that. What's happening now in Miami, we don't have those things. People protest here, they protest for basic things. It's not like some crazy notion waving the flag and they're gonna start shooting, and because their guy is not we don't have that here. So our stress level is down. Panamanians know how to relax, okay? They believe in working and they believe in having fun. On the weekends, they're at the beach, if I'm on the bus on the weekend, like in the evening, I would literally see in the neighborhood, you see tables, people are sitting around, lounging, the cervezas on the table, and they don't just do one. The music is going, they are chilling. We have to learn how to chill. I think we're learning how to chill here in this country. But I think that's one thing they have going for them. The sense of we not, stressed and pressed to work and be productive and squeeze every ounce of. People are real chill. I told you, I see them when they're working like 11 o'clock, they're like taking their lunch and they relax and they're on the hammock, they're on their phone. Listen, don't bring your stress from over there over here. It's not going to work. You're going to be frustrated. Chill. But having said that, the diet here is not healthy. I'm sorry. I love you, Panama. I love you. And there is potential for you to be a lot healthier than you are now. Okay? I was reading some stats, and I thought I was reading it correctly, but I think I was reading it wrong. In terms of the major health issues they have here, like most Western countries, Caribbean, communities where we have a high intake of carbohydrates, like in Mexico, India, all the Americas and Western countries, cardiovascular disease is still number one here, okay? Strokes, heart attacks, and diabetes has grown over 58% here in Panama since 2009. And let me tell you why. That arroz blanco, that pan, the bread that is available here, the empanadas that people eat every single day, that hojaldre, that fried bread they eat for breakfast. In the morning, you see the average worker walking around, they have a little brown bag, they're eating some fried dough, and then they have a cup of coffee, and those fondas don't have sweet and low or Splendas or brown sugar, it's regular sugar, right? So you have that for breakfast. Then they have something for, maybe a break at 10 o'clock, usually some kind of cookies or crackers. Lunch, the mainstay of the diet is white rice. White rice is a refined carbohydrate. When you eat it within an hour, your blood sugar will spike, okay? And when they're eating that rice, it's not, a handful like this. If you take those little round cups, it's like 1, 2, 3, and then maybe a little bit of beans on the side, and then meats, pollo asado, which is like roast grilled chicken. Sometimes they have beef. They put some gravy on it. If you're lucky, they may have a little bit of vegetable, which is very rare, not vegetables, a little salad, okay, or coleslaw. Panamanians do not engage in a lot of vegetables. So, lunchtime, you have all that rice, and then they shut it down, wash it down with some Coca-Cola. Coca-Cola is king here. McDonald's, Coca-Cola, they are everywhere. And then they sponsor a lot of activities, which means people are going to buy into it. I watch the television every single day in the morning where they have all these people talking. They usually have like a cooking portion, and usually they're trying to promote some product from one of the major retailers here. And what they're cooking, some kind of pastry with flour, sugar, mantequilla, butter, salt, cheese. They love chorizo. Chorizo is loaded with salt and it's cured meat, bad for you. People having mounds of it for breakfast, and then they wash it down with Coca-Cola or some kind of other soda, or they have the Malta. Very rarely do they drink water. And then you have a mid-afternoon snack, some kind of bready, sweets with a Coca-Cola. Then you have dinner. It's a repeat. So now there is a campaign in the news. Dietitians are telling people you need to reduce the amount of rice that you eat. But when you're poor and you can go to the fonda and have a meal for $2, 2 balboas and 50 cents, I mean, what do you tell people? Same thing when I used to tell my family and friends back in the US, and I'm like, you have a little meat with your rice. The rice is the mainstay. It should be just a little bit aside. But they say, oh, Miss Maggie, go sit down somewhere. I'm like, okay, I'll sit. And then I'll see you in the clinic when you come here with your blood pressure and your blood sugar is out of control. My blood sugar was starting to spike when I was, 45 pounds heavier last year. And I'm like, oh, But stress, menopause, everything. And I'm like, I can't keep doing this. I'm going to die young. The thing is, you may not be afraid of dying, but dying of a chronic illness is no fun. If you've ever seen somebody take their last breath when they're struggling, when they're gurgling and drowning in their own juices, when their lungs are filling up, it's not something nice. I've had people tell me, my family, they've all died of amputation of one leg or two. That's the way I'm going to go. So I'm going to keep eating and take my insulin. Okay. Diabetes is one of the worst diseases you can have, okay? It messes up all the arteries in your head and throughout your body, so you have a high risk for stroke, heart attack. You got blood clots in your legs that cut off your circulation. That's how you start losing toes, your legs, your kidneys stop functioning, and then you have, kidney disease, you're on dialysis. People have been protesting, we don't have enough facilities for dialysis. But we need to start from the beginning, from the front. Now, they were saying last week, they have children with hypertension and diabetes. The obesity rate here is insane. This lady said to me, she's like, we don't have skinny people here. You have to have a little meat on your bone. It's a cultural thing. But it's not all good. Having a lot of meat on you is not healthy. I'm sorry to tell you that. Okay? And I know the guys like the big booties. Well, I don't have them. I was absent when God was giving them. But look at your side and you see. And your face, that's when you're going to stop losing weight first in your face. And diet, watch what you eat, cut down on the rice, on the meat. All these are inflammatory foods. And then drink a lot of water. Get rid of the sodas. Get rid of that Coca-Cola. You don't need it. It's sugar. Sugar is an addiction. Once your body is used to it, there is nothing good. It's like smoking. There is not one good thing about smoking. Sugar, it just feeds something in you. It tastes good. but it's not, you don't need to ingest sugar, because if you eat a regular diet, you're going to have natural sugar in your fruits and some of your food. You don't need to keep drinking sugar, sodas. So, as an expat, I know we fall in love with how wonderful the food looks. I say it takes a little bit of ingenuity, and that's why people say I have to go to different stores to find what they need. I love to go to the farmers market because I get the fruit there. That doesn't mean when you get home you don't wash it, because like I said, there is pesticide. Don't think, you can't have a farm that is acres and acres to tell me you don't spray to keep the bugs out. If you believe that, I have something else for you, okay? Don't be naive. So choose wisely. People who are juicing, I applaud you. You want to do your smoothies, I applaud you. Just buy the green vegetables. You need to have a mixture in your vegetable. All the peppers and the greens. You can have some yuca, but don't let it be the main part of your diet. You can have a little bit of rice, but don't eat it all the time. And the bread, I went to Reba this morning and I had a couple, but I know I don't eat it every day. You have to have self-control, okay? What happens with your body is like when you keep going the onslaught, you keep putting so much sugar in your body and the insulin is just hard to keep up. Then you start having insulin resistance, and that's when you start having the belly, and then your blood sugars are not controlled, and diabetes sets in. And diabetes is something you may not be able to prevent because it tends to run in families, but you sure can control it by what you eat, exercising, and controlling your weight. So, I'm sorry, Panama. I love you to death. You know that. But we have to do better with the diet. The obesity, the diabetes, the cardiovascular disease is not good. And it's going to cost your government a lot of money. We have to start at home with the kids. When you say to the kids, what do you like? Arroz and pollo, because that's all they eat. What about espinaca? What about lechuga? What about all the vegetables? I guess if you were to ask some kids here, they would know. Because when I look, I see the fish with the patacones and a little bit of coleslaw. I see the rice, the little bean, and pollo or chuleta. And then sodas. And sancocho, I love. Sancocho, you can have sancocho, but it's not going to hold you, right? And then with the sancocho, they always say, would you like the arroz? And I'm like, no, thank you. So, let's take care of ourselves. We come here, yes, the stress is down, but let's make sure we have better food choices so we can stay healthy and get moving. Whether you go to the gym, whether you walk, move. Like today, I was looking for some place and I went round and round and round, and I'm like, oh, then I got my exercise. I was sweating like my friend. I had my little towel. I was just dapping it. I sweated it down. So I came here, I had to rehydrate, and I'm good. Don't stay home and sit. Do something. Start moving. Okay? Well, that's all I have today. I don't want to be a killer joy. I'm just telling you like it is. As a healthcare person, I see what diabetes can do. It's not pretty. Tina Turner was saying that she didn't take her hypertension seriously. And I wrote a little piece the other day and I said, even if you're healthy, like I had pre-hypertension, so I have my little machine here. Every so often I check it, and I'm like in the 120s, over 70s, 80s, which is perfect for me. But once my lower numbers start creeping up a little bit, I do have some medication, and I'll take maybe half a pill. I'm not gonna say, oh, I'm in the gym every single day, then I don't need my blood pressure medication. How do you know? Check it. You may still need it. And as you get older, your arteries are going to become stiff anyway because of age. I see some people, oh, I don't want to have lines, like you're not going to age. Well, your body is like a car. I hate to tell you. The parts are going to get rusty. They're going to start disintegrating. So you're not going to live forever. And the organs, you think of your heart. And I said, my heart has been beating non-stop for the day I was born. That's a lot of beats. And eventually it's going to get tired. Okay? Enjoy every day. Be smart. Take care of yourself. God loves you. I love you. Au revoir. À la prochaine.